Morning everyone, it's nearly the end of the week and ready for another weekend. Hope whatever you're doing this week is going well. Ready for part 6 of myth busting around laser therapy. I just have one thing I do need to kind of say from my last video. I totally forgot to link it to my train theory. So obviously we talked about frequency of treatment, and so in terms of my train theory, it's how frequently that train is leaving the station. So quite simple, but again, keeping it really kind of straightforward and hoping it all makes a bit more sense as we link it all together. So this video today, I actually had a bit of a request for this one, and we're kind of slightly going off a little bit the theme in terms, so far we've been focusing very much around the device itself. But this one, we're just going to kind of chat about research and what research is out there around laser. Now, this is a really common question I get in terms of either people saying, oh, what research is there, or kind of saying there isn't any. And I think one of the biggest misconceptions around laser therapy is that it's a new technology, and there's not much research because it's so new. Actually, laser is quite an old technology. It's been researched for decades. I think kind of 1946 is kind of when PubMed has kind of data going back. But you know, for decades it's been researched. But as you kind of can appreciate from the video so far, there are so many different elements around laser devices that it's really difficult to pinpoint why did we get a response. You know, was it the wavelength, was it the dose we used, was it, you know, whatever it was. And we talked about irradiance and how we're kind of only just really understanding the importance of that. So in terms of how much research out there, if you go today and look on PubMed, if you search laser therapy, there's over 108,000 papers alone. If you search photobiomodulation, which is a newer term, there's sort of over nearly 8,500 papers. And to put that in context, when we look at things like ivermectin, there's about 10,000 papers. I did a bit of research around pulse electromagnetic field therapy the other day, and you've got around 46,000 papers. So actually there is a ton of research out there, and that's human, equine and small animal, which is really important, because I think when I started using lasers around 10 years ago, a lot of the research was very much human that had been kind of cross-translated, or a bit of equine. There wasn't really much small animal. And we have really kind of made big strides in the last 10 years to change that and to really focus in on that. And if any of you have heard me lecture before, you know, I talk a lot about some of the newer papers that have been coming out. And I don't have time to go through every single paper in this video, because, you know, there is so much data coming through. There's still a lot we need to learn. I will never say that, you know, we know absolutely everything about laser therapy at all. So there's still a lot that we need to discover. But I think we're getting to the point now that, you know, when we talk about dose, irradiance, you know, frequency of treatment, wavelengths, we're so much more comfortable now with what we're using to make sure that, you know, what we are doing and what we are using is going to be effective. There's also the element of different conditions, you know, whether we're treating superficial conditions or deep tissue. You know, we're really broadening the use of our laser devices. Traditionally, laser was very much seen as treatment for arthritis and you know, wounds. I tried to change the thought processes around how we view it, rather than thinking of it as a treatment for a specific condition. Those of you that have heard me lecture, you know, it's a tool for pain, inflammation and tissue damage. So when we think about those three elements, that is a huge range of conditions. And again, when we look at the research that's been published recently, you know, very much traditionally the focus was around either soft tissue damage, tendon ligaments, or arthritis, and there's some really great papers that have come out in the last few years. There's one around hip dysplasia, where, you know, we're doing a double-blinded placebo-controlled study in dogs to look at the comparison of a placebo sham laser versus real laser, and the results, you know, really enthusing there. Elbow OA, where they do a direct comparison to meloxicam, and again the results are really interesting, that we can get more effective pain management that even lasts longer from that as well. Both studies quite small, so, you know, we're not completely there yet, but in terms of getting small animal data, it's incredibly difficult. So they're really great starting points. In terms of other conditions, you know, like I say, we've really branched out into more you know, conditions we wouldn't typically think of. We've got a study out on idiopathic diarrhea that was done in police working dogs, that was done in Portugal, that again kind of was a comparison versus psyllium husk, so using laser versus psyllium husk, and actually in some of those cases within 24 hours they actually got back to kind of fully formed feces. So great positive results there. There's a recent paper just been, it's not quite, is again really early stage, kind of just indicating here, but the use of using laser for cognitive dysfunction. Now again, that's really early stage, but again the results showing a 46% increase in cognitive function. So again, as we learn more about these conditions, you know, dental, post-operative dental, we see studies, IVDD, degenerative myelopathy. Now that's a review, that paper, a retrospective paper I should say, sorry, but the results are really incredible. You know, in some of these cases we're never going to stop the disease, but if we can slow down the disease processes, and what we saw there was two groups. Again, you know, I'm more than happy to send links to these papers because I can't go through every detail in this video, but what we saw was ended up with two groups that had same inpatient care home plans. One group ended up with a low dose of laser, using a lower powered laser, versus the group that had a higher powered laser and a higher dose. The low dose group had an expectant lifespan of still around 12 months, which is normal for this condition, but our higher dose group actually had on average a 36-month lifespan. That's huge for a condition that we see so typically, you know, within 12 months, kind of presenting for euthanasia because of how fast they've deteriorated. So I guess what I'm trying to say in this video is that there is definitely an abundance of research here. Yes, nothing's perfect, but, you know, there never is in research. That's why we do research, is because we really need to kind of pull apart everything and learn more and try to figure out why we get results and why potentially we don't. I think we still have a lot to learn around laser, and we're going in the right direction. So, you know, if anybody has any interest around those papers, I'm always happy to kind of share so that you can take a proper look yourselves. But yeah, so that's my answer around, is there research? Absolutely, there is tons of research. It's just about taking a look and looking at what exactly you're finding, whether it's about devices themselves and looking at wavelengths and all that side of things, or whether it's clinical applications. So hope that answers that one. I think our next video will possibly, I'm still not sure what I might cover in the next one. Again, maybe if you guys have any requests, then I'll take a look at what things you want to hear. But thank you for watching again, and hope this was useful.